Welcome guys, welcome back. Now let us see the some problems and diseases which is relating to bone system. First of all, we have arthritis. I told you arthritis and osteoporosis. Arthritis is a weakening of joints so that you will feel so much of pain when you move your hands, elbow or knee. Osteoporosis is something brittleness of bones. You will have a cracked bones. And there is something called kyphosis and gout. Gout is an inflammation formed between the joints, guys. It's very bad. And you know what, when people form gout, they feel very stressful. They feel so much of pain in the joints. And there is something called rheumatism, and there is a jam which happened in the joints which doesn't allow you to move forward. Particularly they are very much affected during the winter seasons, and it was very painful for them. And there is something called luxation, herniation, which is not very common, but arthritis and osteoporosis and gout is very common, guys. There is more to it. Like there is something called sciatica, which is happening in the hip and arthroplasty related bones. And there is something called tumor in the bones. See, which is very bad. And you have scoliosis, which is like bending of your spinal cord. That is also a bone related problem. And we discussed about osteoporosis and stenosis. See, joints weakening, and then you will have a pain in the spinal cord. You can see the red regions. You will have a lot of pain and inflammation. These are all the problems which is relating to bone, guys. And you know what, there is always a bone breakage happens for many reasons. One is injuries. Of course, if you have injuries, your bone will break. There is something called spiral breakage. There is something called transverse, which is like a little crack, and there is something called complete crack. See, there is something called brittle. Like it becomes brittle when any accident happens. That is called comminuted crack. So these are all the different kind of fracture happens, and it's not just because of injuries, guys. Sometimes because of improper food habits, deficiency in calcium, deficiency in vitamin also largely helps in fracture. Have you heard people falling in the bathrooms in their old age? It's not because of their falling, guys. It's not because of falling. Of course, they may fall at their early 20 age also, but at that 20 age, did their bone break? No. They're left with small injuries. But why it breaks in the 70 age when they fall in the bathroom? All their bones got brittle, weakened. That's how the fractures happen. See? And there is something called Paget's disease. You can see bending of knee bones, bending of the leg bones. This is very common between people, guys. People with a normal knee bone structure and Paget's bone. See how it is bent. You can see Paget's disease. It's a bone enlargement and deformity happens inside a structure so that it looks like a enlarged structure, guys. This is one of the common problem with people. And you know what will happen? There is a risk with athletes, guys. Bone mass and aging are really proportional. Bones are living tissue that constantly break down and rebuilds. Okay, so it's very interesting. It's a living tissue which constantly breakdowns and rebuilds again and again. It typically peaks in early 20s. Then people start to slowly lose one more bone again and they gain back. That's the simple science about bone mass and age, guys. So osteoporosis is when bones become thin and fragile. It's associated not just with aging, but also with treatments for chronic disease. See? And there are good risk factors we can say for osteoporosis, guys. You know, the genetics is one of the big reasons. Smoking and sedentary lifestyle, very poor eating habits, inadequate muscles and exercises you didn't do. You take a lot of medications. So these are all the problem with respect to osteoporosis. What are the risk factors? Obviously, your density of the bone will get very low. Low bone mineral density is the biggest reason for osteoporosis, guys. 90% of the peak bone mass is achieved by age of 18. That's commonly I told you. And athletes are reported to have 10% higher bone mineral density than non-athletes in general because they run. They keep their bones and muscles in continuous tension and action so that it gets strengthened. They take a lot of calcium, they take a lot of vitamin D, they take good amount of food intake so that their bones and structure remains very strong to the normal people. See, this is a very simple explanation of healthy bone and osteoporosis cross-section bone, guys. You can see how it's brittle. It'll break, guys. See this picture. You can see the structure is so weak. When somebody hits you, you will definitely break your bones. When somebody falls down, automatically you get fracture. You get complete fracture as well. This is called osteoporosis, guys. See the normal bone matrix and osteoporosis cross-section. I think you will get a good picture of what I'm showing you, because this is how the bone will get weakened. So there are many stages in osteoporosis, guys. You can see there is a basic osteoporosis, there is severe. Severe is something which very old age people get. Because of complete weakening of bones, your bone mass density is completely weak. Even if somebody hits them a little bit, their bone completely breaks down. That's a very, very worst stage, guys. And there are a lot of benefits of bones in our body. We will learn that in the coming video, guys.